Our next talk is focused on social determinants of health and how it impacts the health of those in our community. Now, Bonnie Hartwick was in family medicine prior to coming back to Covenant Healthcare. She has done transitions of care for heart patients for the past 9 years and health and wellness prior to that, at which time she was able to get her certification in wellness coaching. Now, all combined, her current position with the Heart Failure Service is a perfect fit, whether doing bedside education or coaching the patient and or family members to reach the goals they choose to meet. Bonnie, we are looking forward to your comments, so take it away.
I was asked to do this session on social determinants of health. While I was preparing for this, I asked some of my colleagues and some of our other non-clinical staff at Covenant, what do you think about when you hear social determinants of health? Now, some of you in the audience may be familiar with that term, while others may find it to be a bit more complex. And you might even have the same response that several of my peers had. One said, well, I guess I'm not familiar with it. It means something that would benefit others, or it may be determined by race, income, geography. One said, I really don't know. So what is it? So the World Health Organization defines social determinants of health, and I quote, the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by distribution of money, power, resources at the global, national, and local levels. It can include food insecurity, violence, substance abuse, transportation needs, housing, medication management, and quality of medical care. So what impact does it have on us as a hospital or even as a community? Let me tell you about Ben. Now, I've changed all the names in these examples. In fact, I'm using my son's name with his permission. So Ben was hospitalized for his heart failure. He is in his early 50s. He's very charismatic smile, and he seemed eager to learn more about his congestive heart failure diagnosis. I was asked to meet with him at the bedside to provide education on his low sodium diet, his fluid restriction, his daily weight, his medication management, all of which are a part of his medical management for when he leaves the hospital and returns home. This is something that I do every day, and I don't take it lightly because every patient is an individual with individual needs. So I assumed that he would be returning home to the address that was listed in the demographics on his chart. Well, during this educational session, it was revealed to me that Ben lives in a homeless shelter. He doesn't have access to a scale. He eats the food that's provided by the shelter. He drinks his fluids with his meals, and his medications are locked in a safe place, and they're distributed by the staff. Wow, I had to quickly switch gears with his educational plan. We assume that all patients are going to follow the recommendations of the plan of care when they leave, as we've outlined for them at discharge. The education was clearly explained to Ben, and he verbalized understanding. So now it's at the end of my responsibility. We as clinicians know health outcomes are affected by the patient's conditions outside of the clinical walls, but we must approach care of the medical needs as well as the non-medical needs. Social determinants of health are influenced by policies and programs that have proven to better health outcomes. For example, tobacco use is a leading determinant of many health outcomes, including mortality and quality of life. So what are the policies that have been put into place? We now have no smoking zones in public places, and the cost of cigarettes is nearly prohibitive for most people. Or think of the increased number of safe walking spaces and trails that are available to us as the result of increased activity at the local and national level. Community gardens and farmers markets are available to access healthy food. Let's go back to Ben. His story doesn't end at the homeless shelter. Because of the changes at the local and federal level, social services have responded to the non-medical needs of patients, such as transportation, housing, food insecurity, with the assumption that outcomes and cost will improve the client's lifestyle and in turn their medical needs. Ben is now living on his own in an apartment because of the assistance of the Housing Development Authority. But he's come back to the hospital with another episode of congestive heart failure precipitated by his cocaine use, one of the determinants that affects his medical condition. Ben admits to knowing he should quit cocaine. In fact, he had been clean for nearly 2 decades. His goal is to quit the use of cocaine, but he declines inpatient or outpatient rehab because he can simply do it on his own. He tells me he continues to struggle with that low sodium diet, finds it challenging to read the food labels, and eats most things that he can warm up in his microwave. He can walk the 5 blocks to the pharmacy to get his medications, but he relies on public transportation for other errands and appointments. He enjoys helping a buddy with small jobs. This time, the discharge process is a bit more challenging. He now needs 2 doctor's appointments as well as outpatient lab work post-discharge. Now, his primary care provider does provide transportation to and from his appointments at no cost to him if he makes those appointments 72 hours in advance. He's motivated during this admission, and he does schedule his own transportation appointment. But now we've also scheduled him for that cardiology appointment, and his medical insurance provides transportation. This is another program that's in place at the federal level to assure there's no barrier to keeping appointments with physicians, labs, x-rays, etc. Once again, Ben needs to call 72 hours in advance to schedule. I receive a call from Ben 48 hours before his cardiology appointment and lab appointments requesting assistance with transportation. He cannot find his insurance card in which the transportation number is listed. He tells me he does not have access to the internet service to look it up online. I pick up from there. After calling 3 separate numbers for the insurance that's listed online, I'm connected with a representative and placed on hold for 7 minutes. I can schedule the ride to the cardiology office, but the lab test that needs to be drawn on Saturday morning after 10 o'clock. The insurance company doesn't have a driver after 10 o'clock in the morning. It was then recommended that he take the bus and that they would reimburse him for the bus trip. The representative looked at the bus routes and discovered, oh no, there's no bus route that goes by his apartment. She then recommends taking the cab. Once again, they'll reimburse him the cab amount that he would need. While understanding this patient would need to cover the cab fee up front, I suggested maybe we do an alternate date for his lab work that would accommodate their transportation schedule. The representative told me she'd locate a driver before 10 o'clock in the morning. In my role with the Covenant Heart Failure Service, I help navigate patients through the often complex and fractured pathways. It may be through education or listening and coaching patients to set goals and to make the healthy choices be the easy choices. Sometimes it's facilitating appointments, calls to pharmacies, calling caregivers, or helping assist patients set up their own medications, which can be very foreign to them. Or it may be asking the very sensitive questions in a caring, non-judgmental way to open opportunities to support that patient. For example, do you read? This reminds me of Ted's story. At the time of discharge, he had asked that his significant other be present for the medication review because she managed his medications at home. It very soon became apparent to me that neither of them were able to read. Off I went to get colored stickers, and together we placed yellow stickers on his morning medications, black stickers on the night medications. Well, you get the picture. By taking time to meet the patient at his needed level of care, we were able to empower them to self-manage his medications. Studies suggest that health behaviors such as smoking, diet and exercise, social and economic factors are the primary drivers for health outcomes. Patients with unmet social needs have up to 10% higher annual expenditure. Great advances have been made through programs like REACH, which is a national program aimed at reducing racial and ethnic disparities in health. There are programs to address health disparities faced by people with disabilities. We have national programs to eliminate diabetes-related disparities in our vulnerable populations. There are programs that advance cancer prevention, early detection and treatment, to name a few. The American Heart Association is working to support hospitals in several ways as they address social discriminant disparities to help eliminate healthcare disparities, including medical and legal partnerships, improving health and well-being through activity and healthy eating, addressing violence in many forms, whether it is in the workplace or in the community. I trust that this has given you, our community, a more panoramic view of the medical and social determinants as well as the available resources in our Saginaw community. Good health is not something you can buy, but it might prevent you from landing in a bed and being the recipient of an education session with me. I like how Walt Disney said years ago, the way to get started is to quit talking and begin doing. Thank you for attending with us today.
Thank you so much, Bonnie. Man, you show that we are definitely our brothers and our sisters' keeper, and we just thank you for the tenacity and the care that you show. You hear it in your voice, and wow, we just thank you because there are so many barriers, and you have shown that. But you are helping to break those down for better health care outcomes for everyone. So thank you so much once again. We appreciate you.